Her Story is a program that explores women, leadership, and healthcare. Today, I'm delighted to introduce you to Arielle Mir, Vice President of Healthcare at Arnold Ventures. Arielle's career has spanned government roles, private sector, to advocacy and philanthropy, and underlying all of her roles has been this relentless focus towards solving healthcare's toughest problems, particularly those around complex care and looking at Medicare and Medicaid populations. So Arielle, welcome to the show, and thanks for spending some time with us and sharing your story.
Thank you. I'm delighted to be here.
So first question, as we like to start off all these interviews, do you consider yourself to be an accidental or intentional leader?
That's a great question. Actually, the word that occurs to me is an intuitive leader. Growing up, I'm a middle child. And when you're a middle child, you're never the first for anything, never get your first pick at anything. And you always have to kind of find your way into your space to shine. And so throughout my career, I've always kind of looked for opportunities to move into spaces where there is leadership needed, where initiatives don't yet exist, where there's opportunity to bring people together in a new way, and not always on the already beaten path. So it's felt more intuitive to me.
Your career has really tackled kind of this issue of complex care from a lot of different vantage points. And, you know, for our audience who might not be as familiar, could you just give us a little bit of an executive summary of kind of where you started and some of the roles that led up to Arnold Ventures?
I actually started my work coming out of college in women's reproductive health and reproductive rights. Right. And this is, a perfect example of a really fragmented healthcare system, a place where individuals' needs are not well met, where lack of good information, lack of good coordination, and poor access to healthcare can really have tremendous implications for people's lives. And I started that work in the advocacy space, organizing patients, organizing providers, pharmaceutical companies, and motivating policymakers to make the morning after pill available over the counter. And I loved doing that work. I was really passionate about it. And in doing it for some time, realized that there was a piece of the conversation that I just didn't know very much about. And that was all about kind of the financing and the insurance underpinning of our whole healthcare system. And that bringing that kind of follow the money perspective to my work would really enable me to have an even bigger reach and even bigger impact on people's lives. And that led me to grad school and then eventually to the Centers for Medicare and Medicaid Services, where I assisted the director who oversaw the Medicare Advantage and the Part D program, prescription drug benefit, and then from there to the Medicare Payment Advisory Commission. Right, so these are the two largest, Medicare and Medicaid, the two largest health insurance programs in our country, and the effort that it takes to run these programs and to give policymakers the information they need to improve these programs, to make them responsive to the needs of individuals and providers. It's really complex, and balancing the need to bring data, the need to bring stories, and the need to work collaboratively through really hard problems that are healthcare problems and in our nation's fiscal problems takes a lot of energy. And so I really enjoyed that time working at CMS and then at MedPAC. But then always along the way, you start to see kind of the spaces on the map that are not yet filled. So having seen the advocacy world, having seen the government world, I also got curious about the role that private sector companies, and particularly on the technology side, that they could play to help improve the healthcare system. So it led me surprisingly to Silicon Valley, to a technology company that built both data infrastructure for the National Medicaid program, as well as for insurers and large employers. And again, there, right, it was kind of charting this path to figure out how new technologies, how new energy and approaches to organizing data could serve our public programs and help it make healthcare more affordable. And again, you start to see what what one stakeholder, one actor in the space can do, and it makes you see the opportunities to do more. And so that has brought me back to work in DC at Arnold Ventures, where I now work and lead our portfolio around complex care. Right, improving the really fragmented care delivery system, in particular for people who have Medicare and Medicaid, and figuring out with our grantees and partners what research needs to be done, what policies need to be developed, what coalitions need to be built, what technical assistance needs to be provided to really, complete the circle of a vision for a well-functioning healthcare system for every individual in this country.
Given the evolution of the industry, I mean, you're seeing it from the technology side, the data side, the policy side. I mean, are we making progress? Like, how do you view where, how far we've come over the course of your career? And, what are the issues that we're still trying to solve?
One of the biggest things that has changed over the arc of my work in this space is a real growth in a sense of kind of accountability and awareness of what happens to people outside of the four walls of a doctor's office or a hospital, right? And orientation around population health, around continuity of care and coordination of care, right? Prior to the enactment of the Affordable Care Act, right? We have very few quality measures that providers or plans were held to. We had very few strong incentives for coordination across providers, right? We have very few conversations at the national level about how to really weave together the service delivery and kind of community conditions to help optimize people's health and well-being. And that has been a humongous shift and something really to be proud of. I think the growth in the number of companies standing up ACOs, helping to square the circle of referral loops to social services, to do data and analytics, to support plans and providers as they move into risk contracts. Like that shows that this is, that we've made a lot of progress. At the same time, there's still more work to be done. In particular, I would say in the space of long-term services and support, right? The care that people need to remain safely in their homes, to overcome functional limitations, right? To dress, to bathe, transportation. Those are things that dramatically affect people's health and really can have huge implications for their health outcomes. And yet the providers who offer those services, right, the home care attendants, right, those community-based services, we don't think of them as medical providers. We don't pay them like medical providers. We don't train them like medical providers. And yet, Medicaid is a huge payer of those services. And so this is a place I think where we can look even further beyond the walls of doctors and hospitals to think about improving people's health.
Well, kudos to you. I mean, that's not easy, as you and I have talked about. I mean, payment really is policy. And in some ways, I think our industry is starting to latch on to the fact that the government, Medicare and Medicaid really is the largest payer of healthcare. And so that's really where a lot of this change stems from. I'm curious, you and I have chatted in the past about when we think about leadership, it means different things to different people. And although you're making decisions every day, a lot of the body of your work is really how to influence the decisions of those, entities or policies more at kind of a frontline level, right? And so it's really, you kind of have to hand off to others to then make a call. How do you think about influence in that context?
I think that's the what I was saying earlier about kind of like intuitive leadership, right? There are leaders everywhere, even the ones who aren't elected, who don't sit in the C-suite, right? And among those leaders, of which I consider myself a part, you have a tremendous amount of power and responsibility to determine whose voices are heard, what stories are told, what kinds of momentum is created behind different decisions, what kind of creativity and systems support those policy decisions. And so, when I think about, my role at Arnold Ventures, which is, I'm not a policymaker. I sit at a private philanthropy, the grantees that we choose to work with, right? The reports that we support putting out, the coalitions that we build, the conversations that we broker. Those are all the conditions, those create the conditions for the best possible decisions by policymakers. And we know that the policymakers, they need data, right? They need information. They need to understand the trade-offs. They also need to hear human stories. They also need mental frameworks for thinking about governing complicated programs, right? And you need a lot of people like me and my colleagues, and our partners out in the field to make sure that those policymakers, those members of Congress, those folks in the administration can do their jobs well.
Well, as you know, that's music to my ears. As you know, a health services researcher, I mean, data is so essential to making decisions. So glad that you're really thinking about it from a systemic view. Maybe shifting gears a little bit to kind of how you got to where you are. I mean, you just have a terrific portfolio of, these large organizations with a tremendous impact on the industry. I mean, you mentioned this earlier. You got your degrees in political science and public affairs from the University of Chicago and Princeton, both really tough programs, really kind of the prestigious ones for your field of study. Did you plan on healthcare when you were seeking out those degrees, or kind of what led to the interest in healthcare?
Well, I think it's in my genes. I'm the daughter of an infectious disease physician and a nurse turned epidemiologist. And so I was born with a healthcare mission. And growing up, I always had the sense that there were other tools that I could use to help improve healthcare for people, not just one at a time, in a clinic, but levers using public policy that could be really, really impactful in improving healthcare in this country. I thought it was a hard conversation with my dad when I told him I didn't want to go to medical school, but really use those disciplines in political science and public affairs to kind of chart a path into this work in the public policy space. And I think, right, like just like, there's a wide variety of drugs that can be used to treat different conditions, different procedures, different medical approaches, right, to heal the system. There's a wide variety of approaches that are needed as well.
You touched on this earlier, but with that framing, like you said, you consider yourself to be an intuitive leader. Curious on at what point did it kind of hit you that you are a leader in healthcare, right? Because as long as I've known you, you're just, so passionate about industry. It shows in all the work that you do, and you're just so focused on getting it done, which is awesome. But, at what point did it hit you? Man, I'm actually responsible and in charge, and I have this incredible influence.
A funny story, my very first job in DC was at a kind of behind the scenes advocacy organization called the Reproductive Health Technologies Project. And at the time that I got the job, I was the second employee, right? So I was like right out of college, so not qualified to do anything. and my friends joked that I was the vice president at the time. But what I learned in that work, right, this really behind the scenes advocacy strategy work, is that, when there is a space to fill, when there is a need to elevate an issue that people aren't talking about, right? That every every person can be a leader. And so, like I said, one of the things we worked on was expanding access to the morning after pill. And so I took on the role of coordinating and managing the nationwide coalition of patient and provider groups and pharmaceutical companies. And I just stepped in and I took on the work that was needed to be done, the work that I was passionate about, and where others weren't taking the lead, I just stepped up, and it was that experience. And I think it was a strange first job experience in DC, because DC is often kind of a very kind of like old boys club, right?
Oh, I know that well.
Right. You just have to look at the Congress and the administration to see that women aren't well represented. But in this organization, it was pretty much all women, and this really amazingly tight-knit group of women motivated to improve healthcare for women and families, but who are also really motivated to support each other and to make space and to mentor one another and to cheer each other on. And I think that just put a confidence in my step that helped me to kind of seek out other spaces where I could, take on the work that needed to be done and to do it with confidence, no matter who is at the table.
So, with that, I mean, you basically had an early start, and like you said, you stepped up and you figured it out. As you look back on your career in those various roles, did you feel like there were certain capabilities or, skills that you had to kind of intentionally, seek out or build for yourself, and, depending on the role or the organization, and how did you approach that?
I think the number one skill that anyone can have in any workplace, in any family, in any community is empathy. And in the roles that I take on, right, often as in a connector role, in a translator role, in a building role, you really have to understand where people are coming from and what they care about and what they're going through and what lights them up and what motivates them, and to use that to build a strategy. And so no matter whether I've been, working with kind of technical experts building the Medicare Advantage risk adjustment, the risk adjustment model, right? Or, staff on Capitol Hill trying to, figure out what to put in a major legislative package, right? Starting from that place of empathy and of active listening, and reflective, kind of reflective listening. It's never ever failed me.
That's great. I mean, in the time that we've known each other, I've often sought your counsel on career advice, and you've definitely echoed a lot of those sentiments. And one of the things that you've been really great at helping me think through is decision making, right? So at what point do you decide to make the leap to a different role or a different organization? And you have this incredible kind of Venn diagram mental model, but curious if you could share a little bit about how do you think about making decisions on when to switch roles or different organizations, and what you actually ultimately chase after?
I do think there is a tension, and it's a tension I felt throughout my career. When you do mission-driven work, when you care about the work, when you care about the people that you work with, it can, you can sometimes get tricked into feeling that you are the work, that you are inextricably connected to the organization or the company or the initiative. And it's not true, right? You're a participant. Ideally, you're valued and engaged and feel a sense of belonging, right? But there in each of the roles that we occupy, right, there's a growth trajectory. And when I look for a job, I look for the convergence of three factors. I look for an important healthcare mission, an important public healthcare mission, right? That's the thing that's driven me. It's genetic. The second is an incredible team, right? Smart people who also operate with empathy, who operate with integrity, who operate with good humor. And then the third circle is a growth mindset, right? So for me, I love to change something. I love to build something from scratch. I love to do something new, right? But not every organization is a startup. There's a certain breed of us who are attracted to startups, right? But an organization with a real growth mindset, a willingness to interrogate strategy, a willingness to learn from its mistakes, to grow, to lean into new spaces, to really listen and respond to what is needed. That's kind of the sweet spot for me. And in that growth mindset bucket, you can get to the end of you can get to the end of your growth curve at an organization, and then it's time to move on to the next thing. And it requires some bravery. It comes with it some grief and sadness of leaving an organization, leaving colleagues that you care about. But if I'm really honest with myself, when I think about those transitions, I know that it's kind of intuitively time to seek a new space to occupy. And the beautiful thing about healthcare is that while it's such a huge part of our economy, it's a very small world. And the opportunity, as you and I have circled around one another in multiple phases of our careers. No one ever goes far, and having those relationships, having those shared understandings really has tremendously impacted my ability to be successful at each next job.
Absolutely. And, underlying all of that is people, right? And I know you have a really impressive group of mentors, both male and female. What role have they played in your kind of path and journey? And not only from a decision-making point of view, but just, how you approach healthcare in the world?
Having mentors who have made a seat for me at the table has been, kind of foundationally important. When you walk into a boardroom or you walk into, the conference room of, the administrator or director of something, and, that person that you're with pulls out a seat and says, "You sit here," right? That matters a lot. I'm a person, I always have a good attitude about things, right? I'm a very kind of improv comedy mindset. It's always kind of yes and I have really appreciated having mentors who are extremely skeptical sometimes, who sometimes start from a place of no, and who help me to see the kind of just the different sides of an issue, have helped me to set good boundaries for myself, have helped me to set high standards for what I can and should work with, and have helped me to see kind of what, where I can grow and where I can kind of push myself out of my comfort zone.
Is there a particularly difficult piece of feedback that you've ever received from a mentor that kind of really kind of not set you back, but just kind of caught you off guard? And, how did you overcome that?
A mentor at a recent job gave me a piece of feedback in a review that went something like, "Sometimes you care too much." And it really did set me back. And I thought, well, gosh, that's my superpower, right? I'm passionate, I'm committed. But I think what she was saying is, I want you to give yourself some space to just let go of ideas sometimes, right? Let go of conversations, right? To be a little more, in some ways, a little more sort of playful and resilient around kind of challenging issues, challenging decision-making processes, around, ideas that you might get attached to. And I think what I took out of it was not don't be passionate. It was not don't be passionate. It was, bring more playfulness, bring more curiosity, bring more openness to tricky situations so that you can continue to be yes and you don't get stuck on an idea that just isn't going anywhere.
Right. That's good perspective. When you think about your journey, you've mentioned you were often one of the only women in the room. I know, definitely in the DC policy sphere that's quite common. How have you thought about kind of your experiences? Are you hyper aware to the fact that you're one of the only women in the room? Like, how do you navigate some of those situations? Any kind of interesting obstacles that you faced?
I would say that kind of the secret to my comfort, right? The secret to my ease in a lot of different situations is both kind of a real understanding of the audiences, a real understanding of the kind of the messages and the tools that resonate in different spaces, right? So sometimes you have to come with a stack of data and a stack of statistics where you can read them out and say, here's the thing, here's why you need to care about this because of, you're spending X, Y, and Z. It affects this many people, right? Sometimes that's the thing that gets you in the door is just like a real command of the data, right? In other cases, it's a story. And, I've sat in enough rooms with enough, male members of Congress to know that, a story about a provider, a doctor or a hospital in their particular district is going to be so much better received than, a stack of charts. Understanding kind of the roles that I play, the coalitions that I represent, right? Like when you really feel steady in kind of like who you are, what you have, and what you can bring to a conversation, it's always kind of just given me the confidence to, to find my way in and be heard. Of course, it changes from room to room.
Given all your roles, I mean, so on top of your day job, when you're not busy, corralling national policy, you're also a mother, and not just any mother. I know that you homeschool some of your children, which is quite impressive. I don't know how you juggle all of that, but how has motherhood kind of influenced your approach to leadership?
Well, it's certainly a lot. I think earlier in my career, I had this idea that to be an effective leader, you had to kind of be present in the office at all the times and be the last person to leave and the person to know all of the information and have your hands, in all, kind of your spoon in all of the pots. And of course, when you become a parent, it becomes much more difficult to play that game. And it caused me to see and to kind of grow into a leadership posture of really cultivating a great network around me, trust in the people around me, clarity in the roles that I play and my team play, and to really interrogate kind of what is enough, and what it means to get the job done and get the job done well, and to understand kind of what we're really trying to drive to. And the quantity and the quality, don't necessarily correlate. I would say also, I read a book. I think when my older son Rafi was about 2 and starting to really assert his opinions. It's a book called How to Listen So Kids Will Talk and Talk So Kids Will Listen. And they gave these techniques for, again, this kind of like active listening and reflecting back what you heard. So, when a kid says, "I want a cookie," right? Instead of saying like, "Well, it's dinner time, honey, we're not having a cookie," to say, "I hear that you want a cookie. Cookies are really delicious," right? And to make them feel heard. And don't you know, if that isn't a good technique in the workplace, right? When someone comes to you with a strongly held position, right? When you're in any working relationship, that kind of skill is really, really valuable. And, I would never say to my colleagues, I'm treating you like my toddler son. But those superpowers in motherhood, the kinds of things that you have to practice every day as you're holding the space for another human being to be learning and growing and establishing their own place in the world, it really serves you well in leadership.
That's great perspective. I mean, thinking about you in terms of how you juggle all of that, right? That's quite a load. And, I think we've debated, balance is in some ways, such a misnomer. So we never perfectly get that work-life balance down pat. But what do you do for yourself just to kind of stay sane and, keep perspective and juggle it all?
Well, so for one, to the point of balance, I actually on the side, I call it like my superhero profession. The thing I do at night in spandex is as a yoga teacher and a meditation instructor. And sometimes it feels like just too precious. Like, oh, you do all these things and you check all these boxes, but truly having that physical practice, that kind of body and breath practice, is the space where I kind of work out things in, kind of in my body that I can't make sense of in my mind. Kind of this, to this conversation about, not caring too much, right? It takes practice to let go. It takes practice to kind of know what it feels like to release your grip on something that you care about, right? And you can actually, in yoga, you can feel that in your joints. You can feel it in your muscles when you tense and release. And, I'm not going to get too woo-woo on you, right? But there's a body and mind and spirit connection that really, when practice can support you in all your, supports me in all my goings about life. And I actually love in yoga the balance poses the most. My favorite is a pose called half moon pose, where you stand on one leg and extend your arms out to a T and twist yourself to the side. And it looks very fancy, right? It looks, very show-offy, but the workhorse of the pose is really connecting to the ground, right? Feeling your foot on the ground and using kind of the steady, unsexy muscles in your legs to really help you kind of be in the wobble. And when I do those balance poses on the mat, I get more and more comfortable with being in the wobble, whether it's, being in a challenging problem that you're trying to figure out at work, being in a space of not knowing what you're going to do next professionally. And as you said, there's no way to get rid of the uncertainty, the complexity. But the more we can get comfortable in the wobble, the more we can feel more at ease.
Well, the amateur yogi in me is needing to take a class with you when I'm back in DC. So that's a really good perspective. So kind of rounding us out a little bit. So, you're a learner and you're constantly very thoughtful and reflecting on each and every one of these experiences and trying to take, your approach to the next level. Is there something that you kind of believed early on in your career that you now think about and you're like, that was totally wrong, or I've changed my perspective on that?
Absolutely. Every day. Every day I'm changing my perspective. I mean, I think if you had asked me, growing up, kind of who were the leaders, who were the leaders that we needed to emulate or follow, I would have named the leaders who are elected, the leaders who are out front, and and kind of, are the names and the faces that people follow. And with every passing day, I have a growing appreciation for the leaders who do the work behind the scenes, the leaders who see spaces that are not occupied, or who see conversations that feel intractable, and who show up, who listen, who connect, and who chart a path forward, and who support, the box top decision makers, who support the policymakers, who support the C-suites, and they do it with humility, and they often do it with grace, and that is the leader that I have aspired to become, and that I want to continue to grow into.
And so, building on that, is there a piece of advice you'd give your younger self?
The piece of advice I would give my younger self is to be patient with yourself. We have big problems in this country, big challenges to solve, and we should not be patient with those, right? But you may not have all of the answers today about how you're going to solve them, and about exactly what role you will play. But with intuition, with patience, with real listening and empathy, you will figure it out. And if my younger self had heard and believed that advice, she would have gone on more vacations. She would have really, she wouldn't have as many wrinkles as she does today, worrying about how it was all going to come together. So I would say, be patient with yourself and impatient with the challenges.
I'm curious now that you say that. I mean, with your team now, do you do like regular meditation, group meditation, or group yoga sessions together? Is that something that you're encouraging them all to do?
It is. I actually lead a meditation circle once a week at work, and I find I don't require my team to attend. And I find that there is something, again, I don't want to get too, woo-woo with you, but there is something really powerful about stopping together, about breathing together, about reflecting, on our own, kind of next to each other. And when there are challenging things that happen in the world, when there's challenging things that happen, in our organization, that coming together and just holding that space, where we can breathe together and reflect on our own, can be just a really sweet way to kind of smooth over the edges of doing the hard work of solving our nation's hardest challenges.
Final question then for you, as you think about the legacy that you want to leave behind as kind of, what Arielle is going to be remembered for in healthcare and as a healthcare leader, what would be the title of your autobiography?
That's a great question and a hard question. But I'll take my I have two sisters, and one of my sisters proposed to me that if I ever ran for Congress, that my slogan would be, "I got you, sister." And I love it because I think it reflects a real authenticity of my passion for improving people's lives by improving healthcare, and my willingness to show up kind of at every level. I think about it kind of in concentric circles, right? At every level, right? So, for my colleagues who are paving their own way, who need advice about how to, frame their argument for a promotion, or how to practice explaining something complicated, like, I got the time. I got you, sister. We'll work on this, this problem that's right in front of us. When it comes to, a client or a customer or a grantee, right? the perspective of like, I got you, we're doing this together. We're working, we're committed to something. And then sort of the, I got you, sister, in the broadest sense of the world, to know that, I am someone who shows up every day to work on policy because it affects a lot of people, right? And that there are Medicare and Medicaid beneficiaries and women and men and families all across the country who stand to benefit because of the work that I did behind the scenes. And that really motivates me.
Yeah, that's so well said. I mean, your career is just so so inspiring. I mean, your energy and passion is really infectious. So thank you for caring so much and as much as you do. I mean, you're really a great public servant and have so much that you've already brought to the industry and will continue to bring. And we hope to see you, in public run for office one day. The way that your path is headed. So thanks so much for spending time with us today and for kind of sharing your story.
My pleasure. Thanks for having me.